August of 2017, more than 750,000 Rohingya refugees fled Myanmar, escaping violence and persecution in their home country. Many of them left extremely quickly, carrying often only the clothes on their back, and proceeded to walk between 8 and 10 hours to the border between Bangladesh and Myanmar. That was more than 8 years ago, and today in Cox's Bazar, there are still more than 1 million Rohingya refugees who are living here without really any clear path forward or resolution to the conflict. In fact, within the last 18 months, we've actually seen more than 180,000 new refugees enter Bangladesh, continuing to find that their home country is providing them with only violence and no opportunity to continue to go back and repatriate. GlobalMedic has been working in Bangladesh with our local partners since 2017 to address some of the needs faced by the Rohingya refugees who are living here. We have done this primarily through the distribution of our family emergency kits, focusing on retaining and regaining access to clean drinking water. Access every day to safe, clean drinking water is so critical, and it's something that we don't think about very much here in Canada, but it can be the difference between your kids getting sick and being healthy, the difference between you having to walk to the health post and being able to dedicate your day to other pursuits. Having access in the home whenever you need is also really critical, because even if the water coming out of piped wells around the camps is actually clean and safe to drink, the likelihood that cross-contamination will occur either at the collection point or during storage at the home is really high. This way, using a household filter every time, you can ensure that the water that your family and your kids are drinking is safe and clean. The other components of our family emergency kits include things like basic hygiene items. So these are things like toothbrushes, toothpaste, and solar lights. The toothbrushes and toothpaste and soap all go hand in hand with preserving and maintaining dignity within the camps, but also we want to make sure that people have access to soap in particular so that they can wash their hands and ensure that anytime they're dealing with the water unit itself, everything is clean so that no cross-contaminants are introduced into the system. The solar light is the last piece of equipment that we put in our kits, and it's actually really, really critical. In the camps here in Cox's Bazar, as well as on Bhasan, Char, an island which is hosting now more than 37,000 Rohingya refugees as an overflow camp, electricity is very inconsistent, and at night especially, power sources are not guaranteed. This can become a safety issue, especially for women and children when accessing the toilet after dark. So the solar lights actually are a very small but really, really important tool that we continue to include in these kits to help make a difference in the day-to-day lives of Rohingya refugees who are living here. We've been here over the last week doing distributions in both Cox's Bazar and Bhasan Char to help address some of the needs, and you can see that unfortunately this crisis is not abating. The needs continue to grow, and unfortunately, because it's been more than 8 years since the beginning of the crisis, it's not something that's talked about in the daily zeitgeist anymore. It's not something that's top of mind, and so public awareness as well as funding levels continue to decline year over year, and it makes it harder and harder to continue to address the needs of this massive population who are still living here, who still need support, and who still need that assistance. Today we're distributing around 400 family emergency kits to families here in Camp 3, but we know that that's not enough. This is part of a larger scale distribution plan that we are enacting with our local partners, Gus, and in this current round we have been distributing more than 6,000 family emergency kits. We actually have another shipment of more than 7,000 family emergency kits that is on the water and should arrive in about a month or so, ready for distribution as soon as it arrives. All of this collectively is, just addressing one part of the needs that exist here in this camp. There's lots of coordination that is required between local and international bodies, as well as all of the different organizations who are responding here in the camps in order to make sure that families have access to the tools that they need. Since 2017, GlobalMedic has actually distributed more than 35,000 family emergency kits across multiple different camps in Cox's Bazar as well as in Bhasan Char, and we are going to continue to work with our local partners to address daily needs as they come up. We've also worked to fund a health clinic in Camp 1E, especially during COVID, to make sure that there was public health resources available for folks to help prevent the spread of communicable diseases. Some of the water filters that we hand out to this day continue to be used in this health clinic to ensure that all the patients who are coming in to seek care there have access to clean drinking water when they arrive. The situation here in Cox's Bazar is very different to the situation on Bhasan Char, where more than 37,000 Rohingya refugees have been relocated to help deal with some of the overcrowding here in the camps, where more than 1 million people are still residing. The infrastructure looks very different, the way of life looks very different, but the needs are not dissimilar, and so we've been distributing family emergency kits there, as well as getting those solar lights out to families so they have access to that additional security tool. This is a very large-scale response, it's a long-term response, and GlobalMedic is committed to continuing to address these needs and continuing to get the right aid to the right people at the right time.